State University of New York at Downstate Medical Center is your center for healthcare excellence. Housed in an urban setting in Brooklyn, New York, Downstate is one of 64 campuses in the State University system and the only medical school in Brooklyn. More New York City doctors graduate from Downstate than from any other medical school in the country. Health Center is sponsored by SUNY Downstate and delivers up-to-date information in healthcare and community outreach programming. Its university hospital is known for its centers of excellence, quality patient care, cutting-edge education, as a major scientific research center, and for its emergency room, which is open 24 hours. SUNY Downstate's educational programming includes our School of Graduate Studies, which has trained some of the world's best scientists and teachers, including Dr. Robert Furchtgott, winner of the 1998 Nobel Prize in Medicine. Also included are the College of Health-Related Professions, the College of Nursing, and our nationally recognized School of Public Health. With so much to offer, there's no better place you can depend on. Downstate.
Live from the Health Center at SUNY Downstate, this is Star for Brooklyn.
Welcome to Star for Brooklyn. I'm Tanya Taylor.
I'm Christopher Jimenez. Tanya, great to see you again.
Great to see you too.
You know, I was thinking, so the last time we spoke, we talked about hashtag Be Healthy for You.
Yeah.
And I'm trying to take that seriously. I'm trying to do some things, which I'm going to tell you about in a second. But
Me
first,
too.
I want to hear, what have you been doing?
Okay, well, I have also been taking this seriously. So our guests last week were amazing. So I am trying to go to the gym. Last week I only went twice, but I'm going to try to shoot for 3. I know, I'm feeling good about that. And I'm really trying to eat 3 meals a day. That conversation with the nutritionist made me realize that I'm actually hurting myself by skipping a meal. So those are the things, and drinking water.
No, that's great. Look, progress can be measured in inches. It doesn't have to be changing everything all at one time, but it seems like you're really making some progress.
Yeah, and what about you?
Well, you talked about Jackie, the nutritionist who came and spoke with us last time. So I'm actually trying to cut my sugar down.
Oh, yeah.
I mean, I like donuts, I like cakes, I like cookies, and even healthy things like yogurt can have a lot of sugar sometimes.
Yeah,
so I'm trying to really keep it around 50 grams a day, which is recommended by the American Heart Association. So, I'm going to give it a
I didn't know that. 50 grams a day.
50
Okay,
grams.
I'm going to start paying attention to that.
And speaking of healthy, so our first guest, Dr. Lorraine Sanasi, she is a doctor of health science. She is the assistant professor in the College of Health Professionals here at SUNY Downstate, and she's also the coordinator for the physician assistant program, HIV track residency. She also is an avid runner. So she's going to come and speak with us about how to get started with running, which of course, any type of exercise is a lot healthier. Yeah.
Oh, I'm so excited. Okay, let's go talk to Lorraine.
Great. Come on in.
Come on in. Holy cow, look at those. My goodness.
Lorraine, so you bought some
How
hardware with you.
impressive.
So you didn't not only got to talk about running, you got to talk about how to achieve.
Yeah.
Well, we call
Through
this
running.
bling in running.
Bling.
Wow, okay.
You've got lots of bling there. Some major bling.
Yes,
They're pretty.
thank you.
They look heavy.
They are. If you wear them for too long, you might get some neck pain, but
Okay. Wow, congratulations.
thank you.
All right, can I go first?
Definitely.
So, tell me, how did you start running? Like I'd love to know about sort of, when did you start and for how long have you been running?
Well, I've been running for about 3 years now. So my whole life I was overweight, and I was side railed by a knee injury in high school because I used to play tennis, and then I stopped working out and gained a lot of weight, and I realized that all that weight was actually bringing me down, not only physically but also mentally. So I decided to go to the gym, and I started off with riding the bike there, doing the elliptical, and then I always found the treadmill very daunting.
Yeah.
Running is very scary for a lot of people. It seems like it's impossible. So I stepped on the treadmill one day and I started walking, because walking's easy, it's doable. And then as time went on, I started to increase the speed to a point where I eventually started jogging. I was like, wow, I can really do this. And anyone can really do it. And then after about 5 or 6 years after that, I started taking it to the streets and running outside. And it was very uplifting, both physically, mentally, and it's changed my life significantly.
Wow, phenomenal. That's so amazing.
And so, Lorraine, you know, you spoke about starting off with a simple walk on a treadmill.
Yeah.
And I'm a sports guy, so I'm superstitious. I'm not going to touch these medals because I didn't earn them. But the one medal that you have right here, if you could just hold that up, the New York City Marathon medal.
Yes.
So you went from walking on a treadmill to running 24.2 miles.
Oh my goodness.
Just talk about that, like you said, it's very daunting. A lot of people think, and not that everyone, needs to have the goal of running a marathon, but how do you start from such a little, amount of exercise and work your way up to something like that? Like, how do you do that?
Well, a lot of what running is mental. You really need to believe that you can do something in order to achieve it, and that goes for anything in life. So you have to believe that you can accomplish this and know that it is, for a lot of people, impossible, but really nothing in life is impossible if you put the work and effort. So I decided to sign up for a 5K, and for anyone who's ever run any race, once you hit that finish line, you become addicted. So then I signed up for a 10K. So this is my first real medal. It was a 10K, and which is 6.2 miles. And then of course I was hooked, and I did a half marathon. And the more you do something and the more you realize you can do it, you just want to be better. And running has helped me not only become more physically fit, it's also allowed me to become a better person overall. I feel like I can accomplish anything, no matter what the task is.
Wow, you are so inspirational to me personally. Do you have any advice I ran track in college, so that's why I was so excited to hear.
Wait a second, you ran track in college?
I did. I was a sprinter.
Wow.
But I wanted to do long distance.
What was your event? What was your event?
I was literally probably the slowest sprinter on the team. I did the dash all the way up to the 400, which is pretty much like a suicide race.
That's impressive.
No, it wasn't so impressive. Watching me come across that line, it was pretty sad. The 200 was my race. But do you have any advice for someone like me who hasn't run for quite a while, how to get back into the game? And I'm so happy that you shared about the weight and the knee stuff, because I feel like I have that right this very second, and I'd love to get back into running.
So I think running is not always for everyone. So it's something you should enjoy what you set yourself out to do. So for some people, running might not be it. So I always recommend that everyone start with walking, and then speed that up into brisk walking. And if you have a buddy, that always helps a lot. Someone to push you, to help you move faster. We don't always want to push ourselves because we're scared. And being outside in itself is scary. You're running down the street, you feel like you might get hit by a car, you might feel like someone's following you. So having someone there with you can help push you along. And then you eventually start running together, and not only have you become more fit, you have a new friend who's going to move along with you each way, step of the way.
Excellent.
So, so you talk about, starting the run, right? And the process of, going from walking to running and then hopefully running a race. What about the care in between? So what did you do to kind of because I would imagine that sometimes you're sore, sometimes, whether your legs hurt or other parts of your body hurt, what did you do after runs to kind of help you recover and then prepare you to keep doing it, as time went on?
So rest is extremely important. When you start to become fitter, you just want to keep working out. And that can be exhausting because you're seeing results and you want to keep doing it, but you have to put some rest days in between. When I started off, I worked out about 3 days a week, and as I became fitter, I increased that to about 5 days a week. But rest is even more important than the actual act of working out. So in between, when I wasn't working out, I would make sure I rested, I would foam roll, get massages, and what's very critical is eating well. You have to eat well in order to become healthier.
Thank you so much for taking the time to come and talk to us about your incredible achievements. Thank you. Talk about empowering women. We want you to now check out this wonderful video about a program, or actually it's a symposium that was sponsored by CAMBA, which is a community-based organization here in Brooklyn that has this program called iCare that helps young girls in terms of sexual and reproductive health. So this symposium was called Phenomenal Girls.
phenomenal. What does phenomenal mean? Phenomenal means that you are fantastic, you're unbelievable, you're exceptional. You just feel that you can do anything you set your heart to, and that's how we want these girls to feel.
My name is Vanetta Van Horn. I am the director for Kemba's Eye Care program, which stands for Initiating Change Around Reproductive Empowerment. I am also the creator of the Phenomenal Girls Symposium.
My name is Kiki Nwokoye. I'm the administrator for the Family Medicine Department at SUNY Downstate Medical Center.
The Kemba Eye Care program
is to help bridge the gap to service individuals and connect them to any resources that they might need in order to enhance their life. What we do is we work with all women across the reproductive life courses, which are the preconception, prenatal, postpartum, and interconception women. We do a lot of unconventional outreach in order for us to recruit a lot of the women that we do come across and serve.
We started working with the preconception population in 2017, testing the Phenomenal Girls Symposium.
SUNY Downstate, through its School of Public Health, has been a collaborator and a subcontractor with the Kemba Eye Care program since 2014. SUNY Downstate is the only academic medical center and a major healthcare provider in Brooklyn. Kemba is probably the #1 social services organization that SUNY Downstate refers its patients to.
The Phenomenal Girls Symposium is an innovative approach to provide girls and young women of color the opportunity to participate in growth experiences and highlight positive role models for them to emulate.
For the past 2 years, SUNY Downstate has helped host and collaborate on the Phenomenal Girls Symposium, which has been an incredible way to conduct both needs assessment activities as well as collaborate with other like-minded organizations, and of course to engage with this population in a very effective and meaningful way.
The Phenomenal Girls Symposium was created in response to the negative stereotype of women and girls of color in the media.
They have a voice. The Phenomenal Girls Symposium taught me that I can be comfortable in my womanhood. I think that environment is very important, especially for young girls, since we're so silenced these days.
I think a girl is phenomenal when they utilize their Black girls magic.
So I think through the Phenomenal Girls Symposium, I learned a lot about others and also myself.
A girl is phenomenal by just being who God meant her to be.
Welcome back, everyone, to Star for Brooklyn.
Wow, what an amazing video that was about those phenomenal girls. So inspired.
Definitely, definitely. You know, it's always good also to just learn a little bit about new things. And, you know, a lot of these videos, they just, you know, there's stuff that I never knew about. And then watching them, it's great, you know, really informational.
Truly inspirational. Talk about inspirational women. Our next guest today is Dr. Rupali Sharma. She is an associate professor at Touro, associate professor in pharmacy practice at Touro College. And she is also an adjunct associate professor in the College of Medicine at SUNY Downstate. And she is the clinical pharmacist for the Division of Infectious Disease also at SUNY Downstate. Let's welcome Rupali. Hi, welcome.
Thank you.
Thank you for joining us.
Yes, it's my pleasure.
Wow, this is really important talk. We need to talk about how to take medicine safely and appropriately, right?
Right, absolutely. There's so many millions of Americans that are taking medications, and I think patients always have questions on how to take their medications appropriately. So I'm excited to answer some of your questions.
Excellent.
So I guess the first question, the most basic one, you know, what advice or what suggestions would you have on how to take your medication on a consistent basis?
Yeah, you know, I think one of the most important things that people and our patients that are taking their medications is that, especially chronic medications, that they forget to take. And so I tell my patients all the time that you have to set up a routine, okay? So if you take your medications every morning, then that's the best time for you, or right before you go to bed. Now, there are certain medications that you have to take with meals or without meals, and it's important to certainly read those directions. So when it comes to meals or taking medications right around meals, it's important to read directions in terms of how they should go about taking it. But I think having a consistent schedule certainly helps.
Excellent. What do we do if we forget to take a dose or we take an additional dose? What do we do then?
Right. So this is a very common question that patients will ask. So what I tell them is if they're going to forget to take their medication, it is right around when the next dose is due, then they can go ahead and just skip and take whatever the scheduled timing of the next dose is. But if it's very far apart, meaning in terms of hours apart, then they should go ahead and take the dose as soon as they remember.
Okay.
In terms of the fact that, doubling up the dose is something that you don't want to do because, especially with medications such as blood pressure medications or medications that make you sleepy, because obviously that would have an aggravated effect.
So if you find out you've taken an extra pill, you should wait until after the next time to take it.
And if a patient is experiencing any side effects that are unusual, they certainly should either call their pharmacist or their physician.
Okay.
Rupali, so you spoke a little bit about taking medications for a chronic condition. So I've had patients come up to me and say, what lifestyle changes do I have to make? Like for instance, they'll say, can I have a drink at night if I'm taking this medication? And I always say, speak with your doctor. But coming from a pharmacist, what is your position on this?
Right. So I think what one has to realize is that depending on what is your lifestyle about alcohol, right? So if there is a person who drinks alcohol on a consistent basis, there are certain interactions with medications that you can have, especially because of how alcohol is metabolized, right? And then there are certain medications, especially things like sedatives or sleeping pills, that can aggravate the effect of those medications. So what I say to patients is that you really should try to not drink alcohol on a consistent basis. Having a wine here and there, depending on what medication you're taking, is appropriate. See, the thing is, you have to work with the patients, right? If you tell them that you should not do something at all and it makes a huge lifestyle change for them, then they may not adhere to their medications. So it's important to know what they're doing, how they're doing, and they should certainly talk to their pharmacist and physician or other healthcare providers to figure out what is the best way they can keep their lifestyle as well as take medication safely.
Yeah. I have a question about herbal medication. I mean, a lot of people use alternative and complementary medicines, and some of it's cultural and some of it is just trying to be healthy. What is your position in terms of the use or inclusion of herbal medications?
Right. So, herbal medications are also known as the natural medications, right? So it being natural, it's sort of, something people think that is always safe for them because it's coming from the nature. And my advice is that most of the time, herbal medications can be okay, but there are certain things that you need to keep in mind. One is, where are those herbal medications coming from? Because there have been a lot of herbal medications that have been tempered with arsenic or mercury or whatever it may be, depending on who the manufacturer or where they're coming from. And then there are certain herbal medications that have a lot of drug interactions with the medications a patient is taking. So it's important, again, to talk to your healthcare provider. You're in the pharmacy getting those medications, herbal medications. It's always a good idea to go ahead and talk to your pharmacist and say, I'm taking these medications, because they have a consistent list of what they're taking that they can go ahead and do a drug interaction check.
So any pharmacist could do that?
Of course.
Oh, wow.
Absolutely.
Okay.
Absolutely.
Excellent.
And Rupali, this has happened to me a couple of times where, maybe something's going on, you have a cream or whatever, and you go into your medicine cabinet and it's expired. What do you do with expired medication? I've Googled a couple of times, which is probably not the best thing to do, and it's like, oh, sometimes it's okay to take it, but what are your thoughts on that?
Right. So, so what happens is when you get your prescription filled, at most pharmacies, you will have 1 year of expiration date, right? So it's always a good idea to take a look at the expiration date. Now keep in mind that the manufacturer's expiration date may be a little bit different, but I would always go by what the pharmacy has put as an expiration date. Keep in mind that there are certain medications that can lose its potency, right? So if you open up the bottle or you open up the cream and it looks funny and smells funny, it's a good idea not to take those medications. And you can always go back to the pharmacy and discard the medications that way.
Wow.
So expiration made medications are not a good idea because of, it may not work as well.
Yeah, I'm always running into that with my children's medicine. Thank you so much for coming and talking to us.
My pleasure.
This is really important and
interesting too, though.
And interesting, yeah, because we don't think about it, and we're so inconsistent. And so this is information that we all need to have to be healthy.
Thank you.
Thank you for having me. Thank you.
Welcome back to Star for Brooklyn. Our next two guests are Alicia Charles, Master of Public Health. She is the Program Coordinator for Hepatitis C Services at the Star Health Center, and Dr. Liza Valdivia, who is the Clinical Assistant Professor of Medicine and Director of Hepatitis C Services at the Star Health Center. Liza, Alicia, come on over.
Hello.
Thank you so much for being here. And, this is a pretty important topic for a couple of reasons that we're about to get into. But first, Alicia, so you are the program coordinator of the Hepatitis C program at the Star Health Center. I guess first things first is, how do you engage the patients and even let them know that, this program exists?
Thanks for having us, Chris. So yes, at the Star Health Center, usually we have patients either come in as a referral from either a primary care doctor or clinic or CBOs from the community. We also go out and do outreach events to try to get patients who are a little bit harder to reach to come in. And once they do come in, we go through a series of assessments just to see where they're at, and also go through the process of enrolling them into the program and going from there to determine if they need to actually be treated.
And so when you talk about doing outreach in the community, what are some of the events that you do to, get people to understand what the program's about, and also just to, let them know, hey, this is something that, you should at least think about?
Right. Especially with hepatitis C, I think a lot of times it's kind of on the back burner for a lot of people, even those who are infected, because it's a virus that can be, you can have it and not feel any symptoms. So it's kind of like a silent killer. We try to engage people by doing educational workshops, whether it's in group settings or individual, and also offer rapid testing, which you can get your results in 20 minutes.
And you do those things at the outreach events?
I have done, but we also have a linkage to care specialist who I sometimes accompany, and then other times she goes out on her own.
Great. And Liza, so, when we talk about hepatitis C, what exactly is hepatitis C?
Yeah, that's a great question. So hepatitis C is a virus that infects the liver. Like Alicia was alluding to, a lot of people have hepatitis C and they don't have symptoms. They don't necessarily know that they have it for a very long time. Once you've had it for a while, it can cause significant problems, including increased risk for liver cancer, liver failure, and even premature death.
Wow. And of course, the liver is all of our organs are vital, but the liver is, it's
essential.
Pretty much, yeah. You cannot live without it. The other thing is, so I've been hearing that you can actually cure hepatitis C, not just put it in remission, but cure it. So is that possible now? And how is that actually happening?
Yeah. So we've been very fortunate in the last 5 to 10 years that new hepatitis C medications have come out, and they're fantastic. They can cure almost anyone living with hepatitis C. And the process of getting someone medication and getting them started on treatment is actually, in New York, fortunately, very simple.
Wow. So Alicia, speaking of that, getting people onto treatment, getting people to know, their diagnosis if they have it. Who should be screened for hepatitis C? Like, who is at risk? Who should go out there and say, hey, maybe I should get tested for this?
So yeah, that's a great question. It's a bloodborne virus. So anyone who can potentially be exposed to another person who may be infected with the virus should be screened. So if you're an injection drug user, whether past or current, you should definitely be screened. If you were born, birth cohort, so anyone that was born between 1945 and 1965 should also be screened. If your mother may have been infected with hepatitis C, there's also mother-to-child transmission, so you should be screened. Anyone with HIV, who's infected with HIV, should also be screened. If you've had a blood transfusion or organ donation before 1992, you should be screened as well.
So Eliza, one thing I wanted to ask you, I've worked with clients who, and maybe this was in the past, but I've worked with clients at the Star Health Center who have said they're scared to get on hepatitis C treatment because of the side effects. Is that still an issue, or are there some new medications with less severe side effects?
Yeah. So a lot of patients have heard horror stories of hepatitis C treatment as it was in the 1990s. So at that time, the treatment was mainly injection of medication. Medication called interferon that actually wasn't very effective and had a lot of very bad side effects. But fortunately, in the last few years, the hepatitis C pharmaceutical industry has kind of exploded, and we have all of these new treatment options that are available that are all pills, so there's no injections that are used anymore. They're incredibly effective and very, very safe with very few side effects.
Wow, that's great to hear. Alicia,
yes.
If I don't have insurance, can I still get treatment for hepatitis C? I mean, I'm assuming this is pretty expensive medication.
It is.
So what happens if I don't have insurance, but I feel I fall into that category of, I'm at risk for maybe having it? What are my options?
So yeah, absolutely. Anyone can be treated. Fortunately, there are programs for individuals who are uninsured and even undocumented. That's another concern, especially in our climate that we're living in today. So if you are uninsured, we do have people on site at the Star Health Center that can enroll you through the New York State Marketplace. If you're undocumented, that's not something that should keep you from coming in to be treated, because we do have programs that can assist with paying for the medical visits as well as the medication.
Great, that's such important information. Liza, I want to throw it back to you. So again, in working down at the Star Health Center, a lot of patients also would speak about the fear of a liver biopsy. At what point is that, does that come into play? Is that something that everybody needs? Is that part of the screening process? Or so if you could speak a little bit about that.
Sure, yeah. It's something that in this day and age almost no one needs, actually. Oh, wow. Yeah. So again, so that's kind of an older kind of remnant of hepatitis C therapy from the 1990s. These days, for the most part, I don't think I've ever referred anyone for a liver biopsy before needing treatment. For the most part, we have surrogate markers that can estimate people's degree of liver damage, so we actually don't need to do invasive testing like liver biopsy in 99% of cases.
Right, so that's important. So the medication now, less side effects, and liver biopsy, very unlikely, not needed. I mean, that's great. And how long is treatment? If you were to screen positive and and you're appropriate for treatment, how long would you have to stay on the medication?
So it depends a little bit on the treatment that is going to be planned for you in particular, and that's based on a lot of different things, including whether you've been treated before, how severe your degree of liver damage is, but in general, anywhere from 2 to 3 months.
And can you be reinfected? Like, so you go through the treatment regimen, you're cured. I'm assuming you can be reinfected. You're not immune, but so if you could speak a little bit about that.
Yeah, so unfortunately you can be reinfected, and that's one of the things that we tell our patients when they come in for their test of cure visit, is that unfortunately there is no lifelong immunity to hepatitis C. Once you have it and you've been cured, you can get it again. So it's really important to take care of yourself and really minimize your risk for repeated exposures.
And Alicia, if I was somebody who, let's say I'm sitting at home, I'm watching this, and I'm like, I want to know just a little bit more, because I'm a little worried. I don't want to just run into the Star Health Center yet. Where would you suggest I get some information on hepatitis C?
So usually you can find our information online. We also have social media where you can get the Star Health Center's information. You can also contact me.
So starprogram.nyc, there would be some information?
That is correct, yes. And you can also contact me directly at 718-270-8014, and I can usually get someone set up with an appointment within a week.
Wow, that's great. Well, guys, thank you so much for coming. A lot of important and interesting information. Maybe we'll have you back if that's okay.
Yeah, that would be awesome.
Excellent. Thank you.
Thank you for having us.
Wow, what an incredible show that was. We learned about running and taking our medications.
I mean, we had an author on the show, great inspirational story. We learned a little bit more about hepatitis C, which is something that's really important. A lot of people really, still under the surface, not a lot of people really know much about it, but very informational.
Absolutely. So to you, our wonderful audience, we want to remind you, #BeHealthyForYou. Think about something, just one little thing to change this week to move you towards health and well-being.
Remember, there's a lot of great information at our website, starprogram.nyc. Again, starprogram.nyc. Please check it out. A lot more great information there.
Thank you. Bye.
Take care.